Knock.
Yeah, come in.
Hi, my name is Isaac. I'm going to be your provider today.
Yes.
Please tell me your full name and date of birth.
My name is Emergency Say 021197.
Thank you. Can you tell me why you're here?
I'm at the clinic. I'm here for my routine checkup.
All right. What year is it?
It is 2025.
Okay. So, Mr. Cisse is. Do you prefer to go by Mr. Cisse?
Yes, please.
Okay. So, Mr. Cisse is alert and oriented to person, place, time, and situation. And we're going to be doing his head to toe assessment. Is that okay?
Yes, ma'am.
I have the consent already in the chart. So just doing the general survey, Mr. Cisse appears to be in healthy condition, like it is appropriate for the situation, which is for the physical exam. Starting from the head, I can see that it's normal cephalic. The hair appears, I've already performed hand hygiene and provided privacy. His hair, I'm just going to touch his scalp. Is that okay?
Sure, yes.
Okay, his hair appears to be evenly distributed. There are no lesions, no lumps or bumps there. His face also looks symmetrical. His eyes appear symmetrical, as does his eyebrows. There's no evidence of crusting on his eyebrows. His ears appear to be symmetrical as well. Okay, I'm looking here. He has facial hair, and that appears to be evenly distributed. Any pain anywhere?
No, ma'am.
No pain. Okay. Do you wear glasses?
No.
Hearing aids?
No.
Dentures?
No.
Good. Okay. So, first thing I'm going to do, go ahead and open your eyes for me. Okay, good. So we're going to be doing I'm going to be using the pen light to assess for perla, which means I'm going to see if your pupils are equal, round, and reactive to light and can accommodate. Is that okay?
Yes, ma'am.
Okay. I'm going to grab my pen light. It's going to be a little uncomfortable, but it shouldn't hurt, okay? I'm going to start with the right eye. Going in. Okay, so the pupils are equal. Perla is present. Okay, right eye. My bad. Okay. Perla is present in the right eye. And then the left eye. While we're here, we're going to check the 6 cardinal pillars of gaze. So you're just going to follow the pen light in the direction I move it, okay?
Sure.
Alright, here we go. Okay, so Mr. Cisse's extraocular movements are all intact. So cranial nerves 3, 4, and 6 are intact. Okay. Now we're gonna do the Snellen chart. So this checks visual acuity. So you're going to read the very last. I'm gonna move back just a little bit, so I might be out of frame. However, you're going to read the last one so you can see. The last line that you can see.
LTFBH.
LTFPH, okay, good. So Mr. Cisse has 20/20 vision, that's great. Alright. So also going back to use my pen, so cranial nerve 2, optic nerve is intact. So we're gonna use the pen light again. I'm going to assess your nose, okay? So just lean back, very good. Just checking for there's no septal deviation, there's no drainage. Nasal turbinator intact, that's very good. Okay, good. Also, still while I have the pen light, go ahead. I'm checking his lips. His lips are pink and moist. Go ahead and open up for me. Say ah.
Ah.
Okay. So his uvula is midline. Tonsils are grade 1. All of his teeth are present, and his oral mucosa is pink and moist. Tongue is pink and moist. Stick your tongue out for me. Okay. There's no deviation of his tongue, so his hypoglossal nerve is intact as well. Okay, if I had my tongue blade, I would check for your gag reflex, and that would check for your cranial nerve 10. Okay, so that would be intact as well. Okay. You said there's no pain, no tenderness, so that's good. So the next thing I'm going to do is just check your ears. I'm going to palpate your ears, okay? I'm going to check the pinna over here. I'm going to palpate the mastoid process as well. Any pain or tenderness?
No.
No, okay. I'm going to do what's called a whisper test to check for your cranial nerve 8, which is basically to assess for your hearing, okay? I'm going to whisper the words and you're going to repeat them to me. 12.
12.
I'm going to do it on the other ear as well. 21.
21.
Okay, so cranial nerve 8 is intact. I'm going to be assessing your ear for any drainage, and I'm going to be checking your tympanic membrane, okay? So I have my otoscope. Turn it on. Okay, so this one shouldn't be uncomfortable at all. So I'll pull the pinna up and back, and I'm just looking. See, the tympanic membrane is pearly gray. There's no no drainage. I'm gonna check the other ear as well. I'll pull the pinna up and back. I'm just looking through. The tympanic membrane is pearly gray. The right ear as well. No wax, no drainage. Good. Okay. So the other thing I was going to do is with my ophthalmoscope, I'm going to check for your red light reflex, okay? Then open your eye. We're going to start with the left eye, and open your eye wide. Okay, so I'm using my ophthalmoscope to check for the red reflex, which should be present with the macula as well. And then I'll check this eye as well for the red reflex and the macula being present. There's no evidence of blepharitis in the eye, no crusting. There's no facial droop. There's no drooping of the eyelid. Everything appears to be symmetrical. Okay. So I see your trachea is midline. We're going to palpate your frontal sinuses. I'm going to push up on your eyebrow. Okay. It shouldn't be uncomfortable. Just let me know if you feel any pain or tenderness. Any pain or tenderness?
No.
Okay, let me check your maxillary sinus. Any pain or tenderness?
No.
No, okay. The other thing I'm gonna do is, since I'm here, I'm going to actually go to the back, and I'm gonna palpate your thyroid and your lymph nodes, okay? And I'm just checking to see if there's any thyroid enlargement, which it doesn't appear to be, but we're just gonna verify, okay? Okay, I'm just feeling for his thyroid. No enlargement, and then I'm going to check your lymph nodes, starting with your occipital lymph node. No any tenderness? Okay. Then we're going to go to his pre-auricular, post-auricular, palpating down. We're going to go now we're at the tonsillar and submandibular, submental. Okay, then we're checking his anterior cervical, and then posterior cervical, and then supraclavicular. Okay, there's no enlargement on palpation, so that's good. So the next thing we're going to do is going to listen to your lungs. So when I put the diaphragm of the stethoscope on your chest, please breathe in and out, in through your nose, out through your mouth, okay? I'm just going to listen to your lung sounds. Okay. Very good. No adventitious sounds, so no stridor, no ronchi, abnormal breath sounds across the upper and the right and left lung fields. While I'm here, I'm also going to listen to your heart sounds, okay? You can breathe normal for this one. So we're checking the aortic, the pulmonic, Herb's point, tricuspid, mitral valves. Normal heart sounds, normal cardiac sounds heard. And now I'm going to use the stethoscope, okay? I'm going to do the same thing. Aortic. Pulmonic. Herb's point. Tricuspid. Mitral valve. Normal lub-dub sound heard. I'm going to also here palpate for the point of maximal impact or the PMI. Okay, that's within normal as well. I'm going to do the same to your the posterior aspect to your back, okay?
Sure.
So I'm going to listen to your lungs. So this one you can breathe in through your nose, out through your mouth, okay?
Okay.
Ready?
Yes.
Okay, let's go. Very good. Okay. 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 That's very good. Alright, so while I'm back here, we're going to check for tactile fermeters, okay? So you're going to say 99,
Okay.
okay?
99. 99.
Could you scoot forward just a little bit, please? Very good. Okay, again?
99.
Again?
99.
Okay. And then I'm going to check for costal vertebral tenderness, okay? So just let me know if you feel any pain or discomfort here.
Okay. Okay.
Okay, I'm gonna do the same up here. Just
Okay.
percussing here, okay?
Okay.
Okay, no pain there. So check the heart sounds, the lung sounds, everything is within normal. Next thing we're going to do is we're going to check your stomach.
Okay.
So I'm gonna listen to your stomach. Are you having any trouble having stools or
No.
no? Okay, you passing gas?
No.
Good. You're not passing gas?
No.
Okay. Okay. So I'm gonna start with your right lower quadrant, so the bottom part of your stomach, okay?
Okay.
Actually, I'm gonna inspect first. I don't see any distension of his abdomen. There are no abnormalities that are visible. So now we're going to do the actual auscultation, which is the next step of the abdominal assessment. Okay. I'm going up to the right upper quadrant. Vowel sounds present. Left upper. Left lower. Okay, vowel sounds present across all of the quadrants. Okay, so the next thing we're going to do is we're going to percuss, okay? So I'm just going to do just like that. Oh, actually, start from the right lower, right upper, left upper, left lower. Any pain or discomfort? No. Okay, good. So we've done that. Now we're going to palpate. Okay. So since Mr. Cisa doesn't have any pain anywhere, we will start from the right lower. I'm just palpating, just feeling down. I don't feel any nodules or lumps or any masses. I'm just going in order of his quadrants. Okay. Okay. Alright. So the abdominal assessment is within normal limits. The next thing we're going to check is range of motion. So what I need you to do is to go ahead and tilt your head left, right, and then forward, and then back, Okay, so range of motion is present. He's able to move his neck effectively. Now go ahead and raise your hand all the way up. Very good. And then to the side. Very good. Okay. And then go ahead and extend your legs out. Both legs out. Very good. And then you can bring them back down. Okay, so range of motion present, upper and lower extremities. So now we're going to check for the cardiovascular, okay? So we're going to check for your pulses. I'm checking for your radial pulse. That's present in 3+. I'm going to check for your brachial pulse. Present 3+. Okay. And then I will check your femoral pulse as well. Okay. Good. And then your popliteal pulse. Okay. Let's do your dorsalis pedis pulse. Okay. Good. So all his pulses are normal at 3+. Another thing I was going to do, okay, here, we're going to actually check for your capillary refill. This is part of your cardiovascular assessment. It should be within less than 3 seconds, which the capillary refill is. Okay, great. I'm going to also check for temperature, okay. So I'm feeling with the back of my hands. This, as you say, is warm to the touch. So that's very good. All right. Let me check your legs. I'm checking for any edema, okay? So any swelling in your legs. Okay, no swelling in the left leg. No swelling in the right leg. Okay, good. Okay, well, we did, let's see. The next thing we're going to do, we're going to be checking for your reflexes, but in the meantime, we're going to check for your JVD, okay? So jugular vein distension. So we're going to assume that Mr. Cisse is at a, just tilt back for me, sit forward and tilt back. No, sit forward, move forward. Very good, and tilt back. Okay, so we're going to assume Mr. Cisse is at a 30 or 45 degree angle, and you're going to tilt your head that way. Good. So there's no jugular vein distension noted on this side. Okay, and then, okay, there's no jugular vein distension on his right side either. The other thing we're going to do, you can align your neck, that's good. The other thing we're going to do is assess for carotid bruit, okay? So to start, I'm going to listen or auscultate with my stethoscope. I'm going to use the the bell of my stethoscope, and I'll start one side at a time, okay? Okay, there's no bruit present. Now I'll come to the other side. Okay, there's no bruit present on either side. So now it's safe to proceed with palpation. I'm going to palpate one at a time, okay? Okay, let's see. Okay, good. All right, no carotid bruit present. Okay, so the next thing we're gonna do is assess your deep tendon reflexes, okay? We're gonna use the reflex hammer, and we're going to assess the patella reflex. That doesn't hurt, does it? Okay. So we've done the patella reflex. We're going to check the Babinski. Okay. His toes are not fanning out, which is a normal response. And then the Achilles reflex as well. Okay. All his reflexes are intact. The cranial nerves, we've done the optic cranial nerve 2 is intact, 3, 4, and 6 are intact. We've done the cranial nerve 8, that's intact as well. What we need to do now is we're going to assess your cranial nerve 11, which is just shrugging your shoulder up and down, shrug them up and down. Okay, so cranial nerve 11 is intact. The other one that we're going to assess for is, which one was it? Okay, the other one we're going to assess for was,
Stand up now.
yeah, so we're going to do that as well. Let's see. Oh yeah, let's go ahead and stick your tongue out. Okay, so hypoglossal nerve is intact as well because his tongue is midline. There's no deviation with that either. So now we're going to do the Romberg test. Go ahead and stand up for me. Okay, you're going to have your feet close together, hands at the side, close your eyes. Okay, so Mr. Sisi has he's not swaying, he's standing erect. Now you can go ahead and open your eyes. Okay. I'm going to check his spine while he's in this position. His spine is symmetrical. There's no evidence of scoliosis. Go ahead and bend forward for me at the waist. Okay. That's where they normal is. That's where they normal as well. Okay. Go ahead and stand up straight. Okay. Go ahead and walk forward for me. Okay. That's good. And then just walk back. Okay. So Mr. Cisse has a steady gait. He's not swaying. He's not falling over. So all of that is good. Now we're going to do the heel to toe test. So go ahead and walk heel to toe for me, please. Very good. And then you can come back. Very good. You can have a seat. We're almost done. You can do very great. Let's see. So I think that completes our exam today. Did you have any questions for me?
No, ma'am.
All right.
Thank you very much.
Thank you so much for coming. We'll see you next time.
Thank you.
Okay.